Hello and welcome to another episode of the TLDR UK podcast. I am Zach Michaelis, TLDR's editor-in-chief, and I'm joined today by the ever-sunny Mr. Benjamin Blissett.
Hello. Ever sunny, it's a description that's never been used to describe me. I'm doing good. Yeah, doing very well.
Today, we are going to be talking about the NHS. We're going to be talking a little bit about some of the sort of structural woes to the pride and joy of Britain, but then also they recently opened up to the public, didn't it? For sort of
public consultation.
Yeah, public consultation on how to fix the NHS, basically.
Yeah, and it went about as well as we all expected.
Yeah, so we're going to look at some of the public suggestions for how to fix the NHS. But before we get into that, as is customary on this podcast, I'm going to plug something, and I am going to plug the magazine. We have another episode of the Too Long magazine coming out in December. December?
Yes.
Yeah, December. It is going to be about the US election, which we've been covering a fair bit over on TLDR Global. I think I said this last time, I was contractually obliged to plug something, but honestly, the last Too Long was really, really quite good. And we were really proud of it, obviously, but that sort of intuition was luckily verified by the feedback, or validated rather by the feedback. And really the response was overwhelmingly positive, and a lot of people just actually did quite enjoy it. So if you're thinking, this is probably a waste of my money, well, I'm actually not actually going to enjoy that. I want to support the channel maybe, but I don't want to read, more words from TLDR. Honestly, people apparently really quite enjoyed it. So, do something for yourself, have some fun. Buy a magazine, please. Anyway, let's move on to...
The neediest plug ever.
Please. Let's move on to the main bit of the podcast. The
NHS public consultation.
Yeah, let's just dive in with the public consultation. So can you just, before we get into specific recommendations, what actually is a public consultation?
So it's when the government asks the public for their ideas on a given topic.
And why on earth are they doing that?
Well...
The public.
I know
them.
I don't know. I think part of this is the new government coming in. Obviously, there's a lot of problems facing the NHS and a lot of problems facing the Labour government. And I suppose part of it is wanting to see that they're in touch with the people and that they're sort of being democratic in their approach to the NHS. I think the issue with this approach in particular, though, is that they opted to make the responses public, which for public consultations isn't too common. Usually you'll sift through them and you'll go, look at these fantastic ideas the public have come up with, not, list all of them, including the ones talking about, mandatory euthanasia and God knows what else.
It just feels like they've facilitated like a public 4chan forum. Do you know what I mean? It's just so odd.
It's really strange. That said, there is a voting mechanism, so you can go on all of the...
It's probably it's like a Reddit forum, basically.
It very much is. So you can go on them and see the most liked. Having said that, the most liked one only has 1,200 likes, which considering it's a national... Big, isn't it? Yeah, but considering it's a national consultation, 1,000 likes.
At the same time, if you tell most people, do you want to go look at the
sure, if we're talking about
consultation?
Yeah, but if we're talking about Reddit, like the UK Reddit will have far more, likes on that on a daily basis.
Maybe not about NHS article though, or how to fix
Probably
the NHS.
Not.
Do you know what I mean? And a cute puppy or something like that.
Yeah, but because of that, you can sort of see...
That's what the internet is these days, isn't it? Cute puppies. Go on, keep going.
Because of that, you can see the most liked sort of ideas, which actually are some sensible ones.
Oh, really?
So I feel like we should probably go through some of the sensible ones. I know that you haven't seen any of these, so I'd be keen to see what your thoughts are. But obviously there are some jokey, non-serious ones, which probably also good to go through as well. So I don't know what order you want to do it in.
Do you want to go from the top? Is that, or have you got one?
Do you want to go through?
Have you got one? How would you like to do it? Have you want to?
I'm happy to go through the top few.
Sure. Okay, go on.
So the most liked one, 1,200 likes, was digital records. So they just say records from all hospitals should be available to view at all GP surgeries. And they were told that they went to a GP the previous week and couldn't get their records, but were told that they could at another hospital nearby, which is an issue I've genuinely never really heard of, but it sort of gets to the whole bureaucratic mess of the NHS and how it's woefully behind in terms of technology. There was this scandal a few years ago of them trying to upgrade their IT systems and it, going as catastrophically badly as you'd sort of expect.
Of course there was. Yeah. I forgot about that. So I am, of course, massively in favour of this. I'm sort of in favour of all forms of digital government. I think the fact that the public sector is so behind digitisation is just... It's a bit of an embarrassment, to be honest with you. I mean, actually, the private sector in the UK is a little behind digitisation as well. The reason it hasn't happened, the first person to really talk about digitisation was obviously Blair. talk about digital ID cards. That was part of a sort of way we're going to help reform and digitise the NHS as well. And there's a sort of British idiosyncrasy that means that we consider this sort of like threat to our freedom. You know what I mean? It's a sort of that little bit of American we have in us. Do you know what I mean?
It's a very European as well. I feel like European societies are a lot more...
Europeans are normally, I think, a bit more accepting of that sort of like, I don't know, basically making the apparent trade-off of personal privacy for more effective governance. Us and the Americans are a little bit more wary of it. Anything that we think could sort of be used by the nanny state to control us, we don't like. I think that is, I've never been that fussed about I've never understood the primacy that some people put on personal liberty when it comes to sort of like public policy trade-offs. And I think at this point, it should just be overwhelmingly apparent that even if there is a significant personal privacy downside to digital IDs or digital records, the upside is enormous. At least the downside to not having them is enormous.
I think particularly with health. I think it's different because with health.
You get I completely agree.
The efficiency, even just the increased efficiency will have such an impact on health outcomes, the ability of doctors cutting down their workload. There's so much.
It will literally just save lives. You hear really horrible stories these days, and anyone actually who, honestly, if you live in the UK, you know people in the NHS. It's just an enormous employer, and you hear horror stories about people, and they occasionally get made public. Then there's one recently about someone who died of liver cancer or something like that, just for the simple reason that they got his records mixed up. They just lost a piece of paper, and that was how they kept track of him. And then he found out a couple of weeks later, and by the time they got back to him, he was dead.
Yeah.
People literally die because of the inefficiencies of the current system.
So I'm hearing is you're a fan of that recommendation.
I'm so aggressively a fan of that, and it is the archetypal form, by the way, of investment. When Reeves talks about how we need to invest more and all that sort of shenanigans, people can be a bit wary for good reason, because sometimes your investment is my waste, basically. Some people think HS2 is a good example. Is that an investment at this point, or is it not really worth the money? Digitizing public services is just objectively a very good investment. You can do it relatively cheaply. You can do it for hundreds of millions of pounds, not billions.
I think most people would agree with that. I think the issue that people would have is that the way that we've done it in this country previously there's always been some big fuck up or error or
totally agree, but I still think
I agree. Yeah. It's one of those sad things where it's happened so many times that people have been stung by it that they're against any form of sort of investment in public services that requires quite a lot of friction, because they just feel like it will go badly like it has before.
And this is
unfortunately sort of sad to see.
Yeah, it's literally true of any investment in the public service, though, isn't it? Is that part of it is the short-termism of politicians. That's one of the reasons we haven't invested sufficiently in the public service. But it's also because the electorate just don't have the patience for it in lots of ways. And it's not that it's just that there's sort of blind impatience. It's informed by the fact that historically we've messed up our investment. So I'm so furiously in favour of that. It's made me almost grumpy talking about it.
But does it fill you with some confidence that of all of the proposals that went ahead, that is the one most liked and is the top of that list in the public consultation? Does that fill you with any confidence at all?
Maybe a little bit, but I think it's just not. As you said, there's only so many votes on that. It's not representative of the wider public. I think you'd find more appetite for it these days than you did when Blair first tried to introduce it, which was probably the early 2000s or even late 90s. Because things worked better then, so it wasn't as pressing a need to sort out our public services. But B, also people were a bit more tech phobic, whereas now hopefully there's a sort of sense that we need to do it. Estonia, cool country that does very digital
good
government.
E-government, yeah. The second suggestion and the third suggestion are basically the same. So the second one is make nurse training free again, and the third one is scrap university fees for nurses, which I think is an interesting one. So obviously, 2-3 decades ago, university was just free in this country, which by virtue of that it was for nurses. And since their introduction, there is an argument that friction, that cost discourages people from becoming nurses. I think the issue here isn't so much the argument that nurses should be expected to, it's where you draw the line. Because obviously if you're going to scrap tuition fees for nurses, it's a very easy line to draw for doctors as well. But then you've got the argument for, should teachers be included in that? And then you sort of start pushing along. And I think it needs to be one of those things where either it's free tuition for a lot of different people or not. I feel like that's the real friction here, is where you draw that line, rather than sort of moral case for nurses not have to pay for their training.
So in very unpopular fashion, I'm actually not wholly against student fees, and I don't mind the idea of student fees. One of the things that I think about, I think it's a whole separate debate though, but one of the things I hear a lot about the case of nurses is that there's a limit on the number of university spaces for nurses. That seems like a sensible thing to get rid of, given that we have to, basically let nurses immigrate in to fill our sort of like work shortages in that respect. That feels like an overwhelmingly sensible thing to do. I think when it comes to like scrapping tuition fees or scrapping nurses' fees, the question really is like, what is as a country, we have a nationalised health system. We want to basically use our limited tax reserves to create the best possible health system. What is the best way of doing that? Is it to subsidise education and encourage people to get into education? Or is it to use that money to pay nurses better salaries when they come out, for instance, or to invest in, digitising the NHS or whatever it is? And I think that's a more difficult question, because to me, that question of whether or not you make medical education free, to make it free is to functionally have it paid for by the taxpayer, with the sort of like ultimate end of improving the quality of public health in the country. And the question really then is, given the limited cash reserves available, what is the best way of using that money to improve the public health system in the country? And maybe it's better to just pay bigger salaries instead of subsidising the education in the first place. Maybe it isn't. I don't actually know. That's a very difficult question to answer.
Yeah, and I suppose the other thing is, if you to do, as you say, if there's limited resources and you're using that money to make university fees free, that at the end of their degree, what's to stop them taking the free nursing, then going somewhere else that does pay higher salaries? Australia is such a good example of that. One of
the reasons I actually don't mind student fees and loans is that I think the current system is a bit of a mess because it doesn't have enough market forces in it. But I think that it's a good way to basically. I think that my instinct here is that it would be better to spend the money more directly on stuff like salaries, for reasons, part of the reasons you mentioned, but also partly because I think sometimes market pressures can be fundamentally informative to people who are aspiring to be nurses or aspiring to be doctors as well.
Yeah.
And as sort of reflected in the price of tuition.
Okay, so more sceptical on that one than the first suggestion then?
Yes, probably, yeah.
So the next one is, I don't think we need to go into this one too much, it's just online booking system, which again builds into the first point and well discussed. And then the fourth one, use taxis instead of ambulances for non-emergencies. And it's a very, very long suggestion there, but they're talking about collaboration with the private sector and all this. I actually don't know how this works in this country in terms of emergency and non-emergency use of ambulances.
Neither do I. I think in principle there's nothing I'm opposed to with that. It might be a more palatable way of dealing with the sort of excessive strain on the ambulance services than some of the other solutions proposed. Like, for example, some people have proposed making ambulances cost a bit, like a tenner a journey or whatever it is. And the reason they want that is that they want to basically deter, if we're being very explicit about it, and this is what those policymakers are basically implicitly saying, not me. They want to deter old people who get a bit worried and then call for an ambulance, and the whole shebang turns up, and it's just someone who's just, I don't know, has got a bit of a cough or something. They want to deter them from using the ambulance willy-nilly. And that might be a more palatable way of doing that. I think it would just, again, this is such a boring and technocratic answer, but it betrays my political instincts. I think it would just depend on the cost, although my instinct is probably that's quite a good policy, actually. That sounds like a pretty clever policy.
Yeah?
Because I remember like Uber and stuff is actually a very efficient market.
Well, they were also saying that a lot of a lot of taxis now are trained into how to deal with like disabled people that are being used, and elderly people, so the training probably already exists. A lot of the equipment to get people into probably already exists. And it's not like there isn't collaboration with the private sector anyway, in some regards. So
I do quite like that as a thing. I think the liability would be pretty weird though. You'd be putting...
Yes, that would be the...
Yeah, you'd have to figure something out like that. But Yeah, as long as you could sort that out without it becoming a bureaucratic mess, which I don't really have faith in anyone doing, that feels like a clever policy to me.
Well, the next few I think we're getting down a little bit here because
This is surprisingly, I thought it was going to be like a fun podcast, but it's actually just been like a
quite informative
real
one.
wonk out so far. Yeah, go on.
Improved social care provision, which obviously we all know that needs fixing. I know Boris Johnson had a whole thing about this with his national insurance plans, which never ended up really happening.
Didn't you do a whole video on this as well, though? By the way, it was the social care thing, and then what was that commission called? Do you remember the commission that was?
Not off the top of
and
my
in the
head.
2000s, wasn't it? Or 2010s, early 2010s? It was ages ago.
Yeah, I do know what you mean. I can't remember the name, but I know exactly what you mean.
There was this big commission that basically...
And they didn't implement because
it was in May's manifesto, and it got nailed. And it basically was about the fact that I think essentially you could pay for your care after death with your house, basically, wasn't it?
Tax, wasn't there? Yeah.
Basically, it was called the dementia tax. I think social care is such a difficult problem.
And governments are so reluctant to touch it or to change it or to try and fix it because it is such a large problem and it will cost so much.
Gosh, it's silly amounts of money. This has become a completely separate conversation, but yeah, it's such a difficult problem in part because it's only going to become more difficult as time goes on. And the strain it puts on like local government budgets is just like astonishing. You know, there are local governments they're small bodies in the UK, but there are ones spending billions, £1 billion a year, that sort of thing. Some of the ones in the sort of like southwest, leafier, not super wealthy areas because it's done privately, but like the sort of like quite wealthy but quite old areas in the south, they pay £1 billion a year just on social care. Also, like most of their budget's mental. Yeah, how you fix that problem is just I just don't know what the answer is to that. If you really want to just pay for it properly, you just fundamentally have to do it out of taxes.
Yeah. But that there is exactly why so many that's exactly what I mean about governments being so reluctant to touch it, and especially given the financial situation at the minute. But it is something that the longer they don't try to address the problem, the longer they don't come up with any proper solutions, the worse this, as you said, the worse this becomes. And there is no easy solution here.
I quite like doing this thing though, where you know, the dementia tax in lots of ways. I can't remember the precise details of it, but I do think it was about basically selling your assets after you die, wasn't it? And then using the proceeds to pay for that.
So it was putting some cap.
Yeah. Yeah, exactly. Wasn't putting some cap on how much you could individually commit to it.
Yeah.
Those are quite clever policy solutions in lots of ways because what they try and do is they're trying to like maintain sort of, incentive is sort of almost the wrong word, but like some sort of personal liability so that like people don't game the system in some way or like to try and deter you from getting into the system in the first place. But then also like try and find a way of the state paying for the majority of it because like it's the idea of being left to pay for your own social care is terrifying because you just sort of running out of cash as you get closer to death is a horrible prospect. And I think what I quite like doing is just like zooming out a bit and just being like, fundamentally, this is just a really expensive problem. Stop trying to figure out clever solutions. If you want to solve this problem in the way that we have become used to solving problems like this in our countries, which is just the government pays for it, you just have to find more taxes somewhere.
Yeah.
And then that's just this wider question of like, where do we want that tax burden to fall? There's a sort of technocratic question about is it the Laffer curve, which is where basically at a certain point we're going to be taxing too aggressively to the point where revenues diminish. But I think the main question is just a sort of like, it's just a big thing that the government has to pay for somewhere. Let's just stick with the current taxes we have. Where do you want to direct that tax?
Yeah.
There's just no really easy answer. So the other thing to do is maybe you could, in the long term, what you want to somehow do is just encourage more saving. If you want the tax system to like, the public sector to take like less of the burden, and I think that is probably something that's worth doing. There've been some policy success in this respect. So the Cameron Osborne auto enrolment in pensions is a classic one, because it's just increased the people who are putting money into their pensions from like 25% to like 75%. Massive success on what like a tiny little nudge change. But the more deeply than that, if you want to get people to save up for retirement in those terms, you have to just make the cost of living cheaper.
Yeah.
You have to bring down the cost of housing. You have to make it so that we are very lucky, but make it so that people of our generation can save. because it's very tough to save. You just look at the things that cost more than they should and try and bring those costs down, and then you hopefully get people to save for the future. I think that, the housing crisis interacts with all of these things.
Yeah.
So if you want to, one of the reasons we can't save as a generation is just because we spend it all on housing. And so you're not going to spend it all on housing and be like, oh, I don't deserve it.
I love how you've managed to draw a link between social care and
The housing crisis. Well, I do.
But I agree.
But do you see my basic point
No,
though?
I do.
It's the will not report, isn't it?
Yes.
Is it?
Yes, I think you're right.
But my point there is that those commissions can be quite narrow in lots of ways. They're trying to find something clever in that specific area of policy and some very clever fix, and I get that. But I also just Dill not, and it just lends itself to ever increasing complexity. You come up with those clever little fixes, zoom out a little bit, be like, this is a very expensive thing. If we want to pay for it, it's just taxes. And what taxes do we want to do? And then
yeah. Well, I think we've gone through some of the more serious ones.
We've gone through the entire
yes.
UK economy.
Yeah.
Okay. Right.
I presume you've seen some of the less serious ones.
I honestly haven't even looked at this.
You haven't at all?
No, I've been working.
Wow. Okay. Amazing. I mean, there are some just insane suggestions.
Yeah, go on. Are these going to be ones where you say it's insane, then my sort of authoritarian tendencies are going to be like, oh no, I quite like this.
I am ever so slightly worried. Give me 1 second. I'm just trying to find some. There was one suggestion that just said, give me 10 quid. Can I have 10 quid? I need a vape. Used to be 8 but boss man doesn't like my funny one-liners anymore. But this is what you get in a public consultation. Yeah. So many of those. There's one which is invade France to take their medical equipment. France has medical equipment we need. We should seize it under the UN Charter Article 1. Which I'm still not entirely sure you didn't write that, which is good. There's one that's got a photo of a dog. They let you put photos on. Make this dog the new NHS
flag. That's a good. NHS should have a flag. I think.
Actually, and then the description is less depression because of the dog.
That's good. It's a good answer.
I mean, tell me that, isn't it? Another one was invade Iraq. Use oil for NHS.
Another pretty clever one, to be honest with you.
Which isn't. I don't think it's going to be endorsed. Let Jose Mourinho take charge. Mourinho's won many titles in his career, would make the NHS much more defensively solid. Hire the special one today.
He's got a good track record, you can't deny that. Immense charisma as well, do you know what I mean?
Yeah. I mean, a lot, as you've discussed before, a lot of these things are vibes-based.
They are.
And
honestly, I think Jose Mourinho would be a better Prime Minister than Keir Starmer. And
we're meant to be impartial on this. And the last one I'll leave you on is put slot machines in hospitals. Slot machines are highly profitable items in casinos and pubs. By placing them in hospitals, especially in high traffic areas like waiting rooms, the NHS could generate substantial passive income for investing in new equipment or hiring staff. It also keeps patients entertained while waiting for their consultations. So yeah, any of those you like?
No, but on the serious thing, one of the things that does make me think is that whenever you have these conversations, two things that it just reminds me of two quite depressing facts. I mean, the first is, sorry, this is now very serious, but we just talked about this funny things, so I thought I'd go back to the thing. Yeah, it's just that there is this interconnectedness to all of it, and that some of the things you mentioned as issues, they are. There was a joke about depression, but depression and anxiety are a massive problem in the NHS, and those are not symptoms just of issues with the health service. They're a wider social malaise, and they're probably in some part again consequences of some pretty miserable economic conditions. And I think Wes Streeting is right, by the way, to zoom out a bit when he talks about the NHS, because when he talks about the NHS, he does talk about the way it interrelates with education. The education is not set up. Kids are more prone to mental health, and if you I don't know, for example, you could ban phones in schools, and that would probably help mental health or something like that, and therefore take a strain off the NHS. And Wes Streeting is always talking about how we need to invest in the NHS to decrease the rate of economically inactive people in the economy, and so get people back to work basically, and that will boost the economy. And he's right to talk about this, but it just makes everything far harder to untangle.
Yeah.
And the other thing, it just reminds you of just how much better everything can be. Do you know what I mean? Like, you just think about how undigital the NHS is. It's astonishing, you know? Like, the NHS, it wouldn't even be, I mean, it would be difficult, but it wouldn't be that difficult to just have like a digital NHS.
Yeah.
Do you know what I mean?
But it comes back to what we said before, that when they try to do these things, the companies that roll them out have done quite bad jobs in the past. And I think the concern is that we'll have the same friction going forward. And I agree. It is insane that it isn't
just
already
burn it
digital.
all down and start again.
Well, yeah.
Should we start our own little country?
What?
Our own two-man public health system.
Yeah, that'd be great. Slot machines in all the hospitals. But yeah, I think that's just the anxiety with that. But obviously, that is something that needs to change.
Yeah,
it's,
I mean,
it's
that
insane in
turn,
this
by the
year
way,
that hasn't already happened.
I mean, that in turn is a function of the fact that there's, it gets so, sorry, language, it's just so structural really. And that in turn is the fact that the state just doesn't have the capacity it used to. For a whole load of reasons. I mean, public sector cuts, but also just an over-reliance on the private sector in lots of ways.
Yeah.
I think that made some financial sense in the short term when it was sort of first started under Thatcher, then Blair. But it has definitely hollowed out state capacity, which means that doing anything more dramatic is sort of slightly beyond us. Hopefully we're learning to. I think Brexit's probably a bit of a learning experience, and the fact that we should have some ministry capacity freed up might be useful. Yeah, it's very difficult, isn't it?
Yeah. Well, just one last thing on the digital thing. I've just looked this up. Do you know what year it was that they told the NHS they had to phase out the use of pages? I want to guess what year that was.
It's going to be sad, isn't it?
It's going to be sad, yeah.
I mean, my instinct would be about 2000.
2021.
That's mental.
So that's the system we're in.
It's a chronic problem in lots of governments, though, to be fair. The Germans are famously bad at still use fax machines, apparently. That's what I heard.
That's what you heard?
Yeah.
Got a mate over there, have you?
I do have some German mates,
Yeah.
but yeah.
Amazing. Well,
Nice.
give them my best.
Yeah. I'm hosting technically.
Yes,
Sorry,
you
I
are.
should say goodbye.
Yes. Say bye to the nice people.
That was the least hosting I've ever
It
done.
was.
Yeah.
Say
do you
no-
have any thoughts?
Do I have any thoughts?
Yeah, would you like to say
on edit?
Yeah.
We'll go right back to the start, shall we? Do it again.
Okay,
No,
fine. You're done.
We're fine.
All right, thank you very much for watching. Buy my newspaper. No more saying please now. Buy it now.
Yeah.
Otherwise, I'll be very grumpy. Thank you very much for watching.
Like the aggressive approach.
Let me turn it down a bit. Thank you very much for watching. We will be here to talk about, well, I will not be because I am away, but you will be here to talk about the budget.
I'm so excited.
Unless it's, well, nice. That'll be the end of the podcast.
It's boring. Is that what you're
No, I'm
going to
going
say?
to say, unless I'm here on Thursday afternoon.
Okay.
But
Yeah.
probably not. All right. Lots of love.
Lots of love.
Yeah.
Lots of love.